in how we communicate health messaging could make a massive impact on how people make decisions. Small, just minor tweaking in terms of how we are presently communicating health messaging. It could make a very huge difference. So you know that at the present moment we have got various civil society sectors undertaking research initiatives that are targeted at addressing different angles and different key population groups when it relates to TB and increasing awareness around TB. But there is a part around health communication to say, when all of this has been said and done, how best do we communicate health information? So the thing is, what if at this moment I told you that just some small tweaking of that health messaging could have a very huge impact in terms of how things get to be done on a day-to-day basis? And I must say that this is where behavioral insights come in. It's actually a powerful approach that taps into the human psychology to drive positive behavior change. And also by understanding how people think and decide and also act. So there's an aspect to do with think, decide, and act. We can actually design TB messaging that nudges communities towards screening, testing, and adherence without actually forcing them. So there is an aspect of coming up with tailored messaging, tailored strategies in such a manner that when we come up with that kind of messaging, we're in a position to drive localized change. I think you've heard me talk more and more about this of community-based participatory research. Like at the end of the day, what these civil society sectors are doing is that they want to come up with tailored messaging, tailored strategies through which they can increase screening, they can increase the actual testing, they can increase adherence to treatment. So imagine using low aversions. Like for example, say missing your TB medication could cost you your health. Or things to do with social proofing, where you go like, most people in your community have been screened for TB. To make healthier choices feel natural and urgent, it will be key for us to use those kinds of tactics, those kinds of techniques, such as loss aversion or social proofing. So, in today's session, what I actually want us to do is to talk a little bit more around leveraging behavioral insights for effective social behavior change communication. So we need to talk more about how can we go around doing this. What are some of the strategies that are out there? What are some of the aspects that deal with using psychology, behavioral economics? But we want to turn it down, to simplify our approach in terms of doing that. We want to come to a point whereby as civil society organizations, as we are collecting our data, we begin to understand some of these particular concepts. We begin to understand some of these strategies. We begin to apply some of these key learnings. Like as we collect the data from the field, we keep it at the back of our mind to say that we are primarily doing this to drive change in the communities. We are primarily doing this work that we're doing to gather information that would assist us in terms of program design, social behavior change communication, the nature of messaging that we can then use when it comes to programming. So those are the key things that we're going to be talking about. And to start off this whole exercise, I must say that we need to talk about exactly what is behavioral insight. What does this term behavioral insights mean? So behavioral insights actually, it integrates psychology, cognitive science, and behavioral economics to shape decision making. So the end game of it is to shape decision making. This is used to influence healthy behavior, and drive positive change. So in our communities, we would love to drive positive change in our day-to-day activities that we do. Like I said, we currently have got a target that we want to reach. We want to reach 1.1 million people. And of course, this grouping comprises of men, women, and pregnant and lactating mothers that need to be reached out to. But we need to come up with creative means through which we reach out to these people. We need to come up with means that appeal to their psyche, that appeal to their minds, that appeal to the community members, so that they're in a better position to make decisions without being coerced at the end of the day. So that is why it's key for us to find ourselves talking about this particular topic. And over and above that, why exactly is this BI, so important, particularly if we are to talk about it from a civil society perspective? So, one of the key things that we are trying to do as civil society organization is to address issues to do with cognitive bias in social behavior change campaigns. So you will find that as we undertake social behavior change communication campaigns, we are bound as civil society to lean towards our comfort zones. We are bound as civil society to end up finding ourselves just sitting there thinking, we're going to do social mobilization, we'll go door to door, we'll tell them about the fact that they need to come through and be screened for TB, we'll then tell them about the fact that it will be good for their health, we'll tell them about. But at the end of the day, you might find that people are not going to pitch up for health services. So it is key that we begin to talk about these aspects to do with behavioral insights, so that as civil society organizations, as civil society forum leaders, as community leaders, we begin to craft something that is tailored for the communities that we are serving. Because the truth of the matter is that, there is a lot of great work that has been done, but we are bound to miss, the core of why that work gets to be done if we are not properly aligning. We're not gathering the insights from the communities. And also there's an aspect to do with bridging the gap between knowledge and action. It is common sense, it is common knowledge that it's not so much about us knowing what we need to do. When you think about it, you'll be like, you would know that you're not supposed to touch the stove because the stove is hot. When you're young, you would know that 100% the stove is hot, and they will have told you. And you will have even seen your mother or your guardian trying to cook for you, they get burnt. But for some odd reason, despite the fact that you still want to go and touch the stove. But you know. So which means there are certain behavioral elements that needs to be studied by civil society so that we bridge that particular gap. So it's not so much about us knowing about the fact that this is good for a person's health, this is going to be effective, taking up your medication early is going to be key for your health, and it's not so much about people knowing about it, but it's more about people getting to know and then acting on it. So as civil society organizations, in terms of supporting the clinicians, as men's sector, children's sector, youth sector, and all the other different 18 sectors within civil society, our role in this period where we're talking about trying to bridge the gap, it's actually trying to bridge the gap that we're bridging as civil society. It's around knowledge and action. So we need to bridge that gap, the intention-action gap that is currently in existence, so that we're in a position to have a situation where we sustain the growth, we sustain the interventions that are currently being implemented, we drive people to the health facilities, or we drive people to service points where they can pick up their medication. But also over and above that, why is this behavioral insight so important? So it improves message effectiveness and audience engagement. So there is an aspect to do with the effectiveness of the message. So we want to come up with tailored and targeted messaging. There's a part where we are presently having different sectors going out there in the community. I was with one of my colleagues was actually with the faith-based sector, where they were engaging, with the youth within the churches, and you will find that in some cases there is a mismatch between the two in terms of what is expected by the youth, the kinds of messaging that they would want to see out there, and where those messaging are going to be coming from. Of course, just to let you know, some of the things were something like they wouldn't want gospel music to be used to disseminate health information. They would want secular music to be, used in some of these dissemination of information. In as much as they are going to church, they wouldn't want information to be disseminated using, gospel music. So those are some of the things that, when you look at it, it's like, it looks very trivial and very small, very minute. But actually, it's a suggestion, it's a recommendation from the youth about how they would want to see information being disseminated and what could be the base. Of course, there are other insights before, I preempt some of that. I'm privy to some of that kind of information, but at some point we'll be bringing the faith-based sector to come and talk to that, to say exactly what are they funding from the field. So you find that there are lots of interesting aspects that are coming out from engaging with the youth at a community level. And like I indicated in the last session, is to say that even sports, arts and culture, they're coming up with interesting stuff that are coming from men. And there's been lots of engagements with men in the communities that are playing sports and that are involved in these sporting activities around some of the modalities or means through which we can disseminate information. And what is key in all of it is that when we want to drive change at a community level, we get to have a listening ear that listens to what the people are saying in the communities. Because at the end of the day, when we want to drive change, we need to address some of these pain points, some of these aspects that they could be worried about from a community perspective. And in some cases, we always talk about, as we come up with these interventions, we talk about things like nudging and choice architecture. To say, there are certain aspects that influence our behavior without necessarily restricting our choice. So they influence the manner in which we do things, but they don't restrict our choice. For example, in the public health space, we can talk about making TB screening an automatic part of health checkups. To say that when someone goes there to a health facility, particularly in the South African context, you would find that they are expected to say that to be asked TB screening questions for any health checkup. And that brings in an element of provision, naturally provision of those kinds of TB screening services to every individual. So whether they are coming in for hypertension, for diabetes, for HIV test, for STI, for pregnancy, they need to be asked those TB screening questions. So that way we get to integrate the aspects of TB screening across all service provision, across all service points. Then naturally we then adopt the screening as part of the integral part of health service provision. So those are typical examples of how we could best improve health service provision at a facility level. And the other thing, it could potentially be where we decide to say we're going to put HIV self-test kits in convenient places which are easily accessible, like we do suites and all those kinds of stuff. We put it at the front, we put it in the vending machines, so that they become easily accessible. People easily see them, people easily gain access to them, and people will begin to talk about them. Then resultantly, it will increase incidences of what of testing in the communities. But that's the kind of thinking that we need to be having. Those are the kinds of engagements that we need to be having with our communities, with community people, with key population groups, with men and youth. And for us to do that, we need to have an in-depth understanding in terms of some of the cognitive bias. For example, like we need to understand how people make irrational decisions due to bias. We need to have that part that says people don't always act logically, when making health decisions. Behavior is normally shaped by psychological shortcuts, emotions, or some external influences at times. So those aspects, they tend to have a play in terms of how people make decisions and how people behave in the communities. For example, a person with TB symptoms may delay seeking health care, due to the fear of stigma rather than actual risk assessment. So they could be scared of the stigma associated with it much more than the risk assessment that they will have, done, or the fact that they are at risk of having that TB. And biases impact the actual TB testing, treatment adherence, and in some cases even the prevention behaviors. So understanding these biases will then help us in designing better social behavior change communication. And you'll find that the work that we do in the public health space, it's largely targeted at addressing these kinds of challenges. And that is the centerpiece of the work that we do. You will find that if we are in a position to identify some of these common biases affecting health behavior, we are going to move a step further in addressing the challenges that we are facing. We are going to move a step further in coming up with tailored interventions in our communities. Because what stands between us and that good behavior is actually a gap, that intention-action gap, that knowledge-action gap, whereby our communities, they already know. But there is something that we are getting wrong. Despite the fact that they know, they are still not acting on it. So which means the most important thing, it's a lot more to do with bridging that intention-action gap. But now the question is, what are some of the common things that drive bias, common biases that affect our communities? And some of those, they could potentially be optimism bias, Optimism bias basically is people believe they are less likely to get a certain sickness than others, where they look at themselves and others like, no, me, I'm less likely to have a TB, So, for example, someone who says, I won't get TB because I'm healthy, or because I'm of a certain class, so I don't need to get tested, or I don't need to get screened, because they look at themselves with that optimism, and they are then bound to make a decision based on this bias called the optimism bias. And then the other one is actually, it could be the present bias. And the present bias, like preference for immediate comfort over long-term benefits. For example, whereby someone goes like, skipping a TB pill won't hurt me, today. Whereby I look at it and say, if I just skip one TB pill or this medication for today, it won't hurt me today. And I'm looking at it from a point of saying that at the immediate, I think I'll be fine, on the long term. In any case, the tablet has got a half-life and all those kinds of stuff. It's going to remain in my system, it's still in my system. So if I just jump it for today, it might not affect me in the long term. So resultantly, I end up miss it, and then, those kinds of stuff. The other one is around loss aversion, whereby you've got that fear of losing something. That fear is even stronger than gaining something. So, for example, you could say that if I go for TB screening and test positive, I will lose my job. So that fear ends up, analysis paralysis. You end up analyzing it, and then from there you end up saying, I'll end up losing my job if I go this particular route. And then in some cases it's around status quo bias, preferring the current situation over making any changes. Whereby you just want to stay in your current situation and go like, maybe no one in my family got, TB testing, so I don't need to do it either. So you just go like, considering the fact that no one in my family has been tested for TB or has had TB before, why would I go and test, In some cases, it centers around maybe social norms, social norms are the behavior is influenced by, say, maybe the perceived group norms or some of the community norms. None of my friends talk about TB or they say TB, so resultantly, it's not so much of a big issue. It actually came out from the youth that were being engaged by the faith-based sector to say that, this thing, it was a challenge when people used to talk about it mostly when we were in primary school. But now, people don't talk about TB anymore. It's just like COVID, it is past. So those are some of the sentiments that came out from the youth. So it's not something that is always spoken about. And, we don't think it's still there in our communities, or it has got that much of an impact in our communities. And those are some of the things that are driven from an angle of social norms. And then in some cases, the most common one is actually confirmation bias, whereby we're seeking information that supports existing beliefs. Whereby if I believe something, I'm going to look for information that is in that particular direction, and then it gets to be confirmed that, oh yeah, I got this article, it says this and this and this and this, which means that based on this article, that is true. But I'm actually confirming what I'm biased towards or what I believe in. And I'll be like, I read online that, this kind of traditional medicine, it actually cures TB. So I end up saying, I don't need to take these pills, because they're giving me side effects and that kind of stuff. And also I've got an article that says that these pills, they give us side effects. And so I'm not going to take the medication. So that kind of bias drives some of the common myths and misconception when it comes to health behavior. And all of these aspects, I know there are other forms of bias, but all of these aspects, as people who are in the public health space, as colleagues in the civil society space, we need to be coming up with interventions to say, how best do you address, some of these aspects. For example, we could talk about, let's say, maybe loss aversion. So understanding loss aversion. So where people fear losing more than they value gaining something. So, for example, like loss aversion is actually a psychological bias where the pain of losing is stronger than the pleasure of gaining. Where the pain of losing is actually stronger than the pleasure of gaining. So the question is, how does it affect health behavior? So individuals are more likely to act if they fear losing something. For example, they fear losing their health, their loved one, their time, their income. So those kinds of things are likely to end up influencing how they behave. And some of the examples of TB messaging, it could be missing your TB medication could cost you your health. So it's a typical example of loss aversion, so that if you don't take this medication, you might end up, passing away, or it costs you your health, you might end up becoming unhealthy. But now the implication is that health campaigns should frame messages in a way that emphasizes what is at stake if action is not taken. So in this particular case, we need to, to emphasize what is at stake, like if you don't take your medication, you're likely to end up becoming unhealthy. So, today I'm going to be touching on various messaging, and take note of the fact that these messaging that I'll be talking to, they are just examples of messaging. And some of these, they have come from the engagement that the sports, arts and culture sector have been having in the community. Some have come also from the law and human rights have been having in the community, and the faith-based sector has been having in the community. And these are some of, I've just decided to pick on some of them, just to try and give them as examples. But they all come from different angles and they're targeting different individuals, because these sectors have been engaging, these civil society sectors have been engaging with different people, and these different people have been saying their pain points, their fears, when it comes to the different aspects of the whole education, linkages, screening, or attention in care, all those components when it comes to dealing with TB. Hence, I'll be citing those typical examples because it's something that is still fresh in my mind, and it's something that is currently being underway. So in some cases, it's more about fear-based messaging, or something that we call, we can say is fear-based messaging. But let's look at fear-based messaging maybe versus positive reinforcement. Yeah, positive reinforcement versus fear-based messaging. So you'll find that when it comes to fear-based messaging, we use negative consequences to drive behavior change. Right? For example, you could say, untreated TB can spread to your loved ones and cause serious health implications. So in this case, we are trying to use fear-based messaging. What happens, the advantage of that is that it creates agency and grabs your attention. But also, on the flip side, is that it can cause anxiety, avoidance, and even stigma. Just that one message, someone could interpret it either way. So you'll find that there is no way that we can come up with 3 messages, 5 messages, 15 messages. That will be too little, because you'll find that from one message, people are bound to interpret it from different angles. And it is key that as civil society organization, we come up with different kinds of messaging that are targeting different kinds of groupings of people in the community, so that we can drive change within those particular community. And then in some cases, I think I've spoken about fear-based messaging, and the other one that I mentioned was positive reinforcement. Right? With positive reinforcement, it's primarily focused on the benefits and rewards of taking action. For example, you can say that completing your treatment means a healthier, stronger future for you and your families. So it comes in from a positive angle. So the good part about it is that it encourages confidence and that proactive behavior, to say that if I do this, which means it will translate to me becoming healthy, and I'll be in a position to protect my families. But of course, there is the downside to it. It might lead to maybe less immediately attention grabbing, than the fear-based messaging. But all of these things, dynamics, they tend to vary from one individual to another. That is why you find that when it comes to social behavior change communication, we come up with all of these different kinds of methods and means through which we package our messaging, so that we reach out to different groupings of people in the communities. Because at the end of the day, it's a lot more to do with the target audience in our communities. To say, who are our target audiences and how do we want to reach out to them? And then from there, we go out there and, we come up with different messaging. We co-create different kinds of messaging that addresses pain points, addresses elements that would assist us in reaching out to different groupings of people. So, and of course, the question would be then, you've told us the pros and cons of each of the methods. So what becomes the best way of doing that? So it's an issue of having a combination of all of these. Be it it's fear, to capture the attention, or positive reinforcement to drive a sustainable action. So this could potentially be, for example, TB can be deadly if untreated, but starting treatment today gives you a full recovery and a healthy life or a healthy future. So you have come up with, a combination of both nyana, so that you'll be in a position to address, the fears of the people, but also have that call to action that is more or less like an immediate need for something to be done. So that's some of the things that are coming out as civil society organizations are going into the communities to say, particularly sports, arts and culture, to say, what are some of the best ways of packaging health messaging? Right? And then the other aspect is around, I think I've spoken to it, it's around a status quo bias, and in some cases it's around habit formation. To say that people prefer to maintain their current habits. So we need to come up with strategies to shift behavior gradually through routine interventions. So we need to come up with a means through which we are encouraging continued use of HIV PrEP in the communities, where we're trying to shift people from saying, okay, this is how you have been doing it, how can we best shift from this kind of behavior maybe to, to maybe using HIV prevention PrEP. Because people are bound not to deviate that much from their norms or from what they are used to doing on a regular basis. So these are some of the things that when we do our work in the communities, we are bound to meet some of these kinds of challenges. And then the other part is around issues to do with social norms and peer influence. So where we talk about people get to be influenced by what others do. For example, if I'm to come and say, that 9 out of 10 people in your communities completed their TB treatment. So in the minds of the people, it would register that, people are completing their treatment. So which means I'm also supposed to, follow suit, which means this is what is happening in my community. And it's something that is always missing when it comes to TB messaging, where we don't get to talk about, these successes that are happening. We always talk about the 1.1 million, But if we flip it and say, actually, so many million people, they are currently on treatment, it gives a certain notion to say, if there are so many people that are already on treatment, let me jump into the wagon myself. So we want those kinds of like community-driven testimonials or storytelling. That is why you find that as part of the work that we are doing currently, we are getting to get the TB ambassadors to tell their stories. Even the National Department of Health is getting TB ambassadors to tell their stories, so that they'll be in a position, people that have got lived experiences of TB, they're telling their stories, and they narrate their stories. People begin to identify themselves in those particular stories that they'll be telling. So that is one of the key things around the work that gets to be done at a community level, to say that get the people to talk about their stories so that people can find themselves in those particular stories. People can begin to understand some of the lived experiences, some of the things that people went through. And then in some cases we talk about the framing effects in social behavior change, where we talk about how information is presented influence decision making. So how we package the information. For example, if you are to say that 90% of patients recover from TB with early treatment, versus say maybe 10% of people don't recover. 90% of people recover, versus saying that 10% of people don't recover. Already you can even hear it in your mind. The moment I say that 90%, you are seeing that positive element. So I'm reporting the story from a positive angle. To say that so many people, 90% of them, they actually recover from TB if there is early treatment. as compared to having a message that says 10% don't recover. So there is a part that says that as civil society organizations, as community people, we need to come up with means through which we frame our messaging from a positive perspective, from a positive angle, so that we will be in a position to drive change within the communities that we are actually serving. So that way, we are assured of, coming up with positive results in the work that we do. And then, of course, the other parts around the actual application of these behavioral insights when it comes to social behavior change communication. So it is key that as researchers, as community people, as we undertake our community-based participatory research initiatives, we actually are in a position to identify at which point do we actually use this. Like I'm giving you this typical example to say, we are in a space where at a national level, there is this campaign, this 1.1 million campaign. And internationally, there is World TB Day coming up, and which means that we need to come up with interventions that are much more targeted, messaging that is much more targeted. Everyone needs to go out there. I know, like communications, they will tell you about billboards, banners, and all that. But as civil society organizations with limited resources, we can tell you about WhatsApp messaging, we can tell you about social media, we can tell you about the fact that during the COVID era, a lot of messaging went out through WhatsApp groupings, a lot of messaging went out through social media, and it was an effective and efficient means, a cost-effective means through which information was disseminated. And at this stage, we need to be coming up with messaging that is tailored and targeted. And as this campaign has been launched, as civil society organizations, we need to be regrouping to say that what messaging do we want to champion? How are we going to package that particular messaging? And then we review that particular messaging and we take it out there. So which means behavioral insights, they will play a key role in terms of how we package the messaging so as to drive health promotion. They will play a key role when we want to do an emphasis of certain emotions, some agency, we're looking at cultural relevance, social aspects. So these behavioral insights, they'll play that kind of key role when it comes to the work that gets to be done. So these are some of the key things that I thought that, it would be key that we talk about it in the context of the work that we do, in the context of the research that is currently being undertaken by civil society organizations, so that we can drive change in our locality. So, in closing, I would want to say that, as I come to an end, I would want to say that, what are some of these aspects or some of these elements that we need to keep at the back of our minds at this stage when we are coming up with social behavior change communication? Key is that social behavior change communication, it's more about saying there are these kinds of there is knowledge that is already there in our communities. People already know about certain aspects. People that are in our communities already know about certain aspects. But they are struggling to jump from knowing to acting. That is the basic thing. So what is the best way of getting them to jump from knowing to actually acting on it? What are some of the things that are preventing them or bringing in elements of bias in their line of thinking? And when we've identified those, we then say that, how do we assist them to switch, to move from what they currently believe in to actually acting on that? To move from set some of these behavioral elements to actually saying that, you know what, I'm now willing to act on this. So that is the key message that I want us to take home. As civil society organizations, we need to begin to think in that particular direction, because remember, we're not just doing research for academic purposes. We are doing research for purposes of driving change in our communities. And that is the centerpiece of us undertaking research. Because we are doing community-based participatory research that is targeted at driving change, coming up with improvements. And those kinds of improvements are supposed to translate to what gets to happen in health facilities. So, as we do our work, let's keep that in mind. We are not academic researchers. We are doing research for purposes of driving change in our communities. And that change needs to be linked to retention and care, linkages to care. Our colleagues in health facilities need to feel us. They need to know that, oh, civil society guys, they are mobilizing this group that was initially not coming here. They must see some significant changes that are happening in the communities. So on that note, that's my parting shot. Let's do research for purposes of driving change. In the section below, or you can engage directly with Best Health Solutions. Let's begin to talk about some of the work that you are doing, some of the behavioral insights that you would want to gather, some of the studies that you would want to undertake in your community. Reach out to us, because we are going to provide you support. We're going to give you guidance in terms of how best you can undertake your activities, how best you can integrate research activities into your current programming, particularly in the TB space. Let's make it a point that we integrate research initiatives, we integrate social behavior change communication. As we undertake our research activities, let's have social behavior change communication at the back of our minds. On that note, see you in the next session. And bye for now.